So every high-income country other than the US has a two-part process to approving drugs. In the US, there's FDA approval, and once you're FDA approved, most cancer therapies then get reimbursed by insurers, be they public or private insurers. But in pretty much every other country, there's a second step, which is where a typically government authority will review the evidence supporting a specific novel therapy to determine whether it's cost effective or not, whether the investment for society is worth it. Because if you're a cancer patient or even a cancer doctor, there are very few things that you wouldn't give a try because it's very important. But obviously every dollar we spend on one thing is a dollar we can't spend on something else. And so the methodology that we use to help make those decisions and to help inform these bodies around the world is called cost effectiveness analysis. And that uses different components to try and work out how much benefit a novel therapy offers and compare that with how much it costs, and designs a model based on clinical trial data to try and work out, is this something we should invest in or is it too expensive? And so, for example, with CAR T, when it was initially approved in the pediatric acute lymphoblastic leukemia population, if you can cure a child, then they're going to go on to have a long and productive life. And so the amount of benefit that you see is much greater, and so therefore the cost effectiveness analysis comes out very favorably because you have many years of life gained that you would not otherwise have had by that child who was cured of leukemia. When you move to the adult setting, it can be not as straightforward because if your quality of life is not normal after you've had the treatment, then the way that the quality of life is calculated might mean that you don't have 100% quality of life. And so there are lots of analyses that then try and compare and ask the question, are these CAR T-cell products cost effective in an adult population such as in diffuse large B-cell lymphoma? And in the diffuse large B-cell lymphoma, so far there are in fact 5 analyses published, and 3 of them found that CAR T was cost effective, whereas 2 didn't. And so some of the things that we talk about both in the education session and in our education book article is about the more nuanced and kind of line by line approach to how you compare those different studies to work out which one you think is most trustworthy and ultimately to work out which therapies that governments and health payers around the world should invest in.